What that means is the FDA has just been asked to give a recommendation for a daily dose to hundreds of people who are different skin color, live anywhere from Florida to Alaska, have different habits of going outside. There's no way they can get a single dose that will do that. And not only that, in my view, this stuff is, the word toxicity is absolutely applicable. The thing that isn't there in the books is the list of symptoms that come with the toxicity. You'll never see that. What you'll see is hypercalcemia, and then they'll quote that. The hypercalcemia doesn't come until you've been on this for years and you've been toxic for years. I guarantee you, though, you will feel awful when your level's too high. Everybody has a different set of symptoms because when you destroy the sleep, everybody has a different set of symptoms. Some of them have neurologic symptoms, some have diabetes, some have pain. When I came into this through sleep, it didn't seem the least bit weird to me that everybody has a different set of complaints, but they all have vitamin D deficiency. You get the vitamin D right, the sleep gets better, and then all the neurologic stuff gets better because the neurologic stuff comes from the sleep disorder, not from the D. There's not D everywhere in the brain. The only neurologic thing is MS. MS is a vitamin D deficiency disorder. All that area of the lateral ventricles where I showed you where the vitamin D receptors are, that plays a huge role in MS. So MS is one of the vitamin D deficiency disorders, but all the other neurologic effects that we see are all from sleep disruption and not having normally restorative sleep. What this means is most of the doctors that are setting up the clinical trials to treat the illness are still looking at the FDA recommended doses. They shouldn't be. The FDA has done exactly what they should have. 3 weeks ago, they were asked to give a new recommendation for the daily dosing. They said 800 international units a day. That was really smart. Because if my government had been putting 10,000 a day into my milk, and it made me feel the way I felt in August, which is usually my month to feel great, I felt terrible, I would want to kill somebody in my government. That is not an appropriate place for this to be. And the fact that it's over the counter means that I can't depend on different suppliers to have the same amount of vitamin D in there. This is one of the most important chemicals that we have at our fingertips to cure people, and we can't depend that the pills have the same amount that they say on the label because they're over the counter. It's not FDA approved, doesn't have to have any of the requirements that the FDA requires. This is a big, big mistake. Okay, the other thing is vitamin D has multiple different layers of complexity. Once you start to read into this literature, you'll find that the top half of the D has different responsibilities. All this seasonal stuff I told you about, that's the top half. The bottom half is how our body hangs together. That means if you don't know what you're doing with this D2 stuff, it should never be there. D2 is not the same. It made all of my patients sleep worse. Now, not all. 99% of the patients don't like this D2. The patients that had low levels, like November, December, when I didn't really know what I was doing, I gave them D2. Because, oh, their level's 8. And I went, oh, this is terrible, you know, everybody else is 30. So I gave them these 50,000 international units D2 pills, assuming that it's because it's a prescription, it must be safe. They all come back in January, February, say, that stuff screwed me up beyond belief. I couldn't sleep, and my headaches were terrible. And of course, my response was, you have daily headache and you can't sleep anyway. What do you know? You know, I didn't believe them. And it wasn't until I'm like every other doctor, yeah, you're crazy. And so the 6th patient who tells me this, I think, man, that's the 6th patient who's told me this. Maybe I should read about this. And then I discover all this D2 stuff, and I think, why are we giving that? You know, that's crazy. What if this acts as a partial antagonist, bumps off the D3, and now they can't sleep at all? That's insane. I actually have one of my patients who ended up at BHC because she became psychotic. She took the D, no, luckily it wasn't my prescription, but she took the D2 every day. She was already very cranky and weird. But then she took the D2. She was very difficult. But she took the D2 every day. She got psychotic. And she wound up, because she couldn't sleep for 2 weeks in a row, she wound up in BHC. There's a big connection between most psychiatric illnesses and this as well. One other really important thing for the cardiologists in the room, many of your patients, D3 is not your only concern. Many of your patients that have AFib, elderly patients who have Parkinson-like disorders, this hits their dopamine. Dopamine runs all this stuff. Once the dopamine gets affected, their sleep goes downhill. All the Parkinson's patients, even before they ever develop Parkinson's disease, have terrible sleep disorders. That means you really have to get in there and supply a little dopamine. So if the patient's got a level between 60 and 80 for months on end and they still don't feel better, send them to me and we'll work with this. By the way, I see nothing wrong with CPAP. I'm not against CPAP. All my patients who have CPAP devices, they like them, they keep them. If and when they feel like it's bugging them and they want to take it off, I don't berate them anymore. But if they feel better, they keep it on. My concept is that CPAP device is there as a crutch until their brain sleeps long enough in normal health that they repair their sleep apnea. Because it doesn't stay there forever. I have 2 patients in which it was reversed from terrible sleep apnea to none. I don't have any sleep studies to show for it now because unfortunately all my people with CPAP, I screwed them up by going up too high on the vitamin D. So now we're on the downside and we're trying to get them better again. So I thought by now I'd have several sleep studies to show that when you get the vitamin D where it needs to be. But it turns out there's a tight little narrow band and you have to be in that band to get the sleep better, and you have to stay in that band for the patient to get better. All right, one other thing for those of you who want to take this, multivitamins are really important because there are a few little cofactors that the vitamin D needs. B12 is frequently there. It's there about 1 in every 20 patients. The vitamin B12 that I stumbled into this first, the gal who had the B12 of 178, she came back with a B12 shot. She was no better. They all told me the same thing. I give my shot, I have 2 good nights of sleep, and then I feel terrible after that. And it turns out we gave it once a month because Medicare paid for it once a month. It is not stored. It is in water like every other waterable soluble vitamin. There are 10 years of research out of Europe that show that B12 pills actually are absorbed just fine when you get the dose up high enough. And what it comes down to is the D drops the acid. We all feel like there's too much acid because the esophageal sphincter is weak. It's all up here. Therefore, we all take reflux medicines. Now we have no acid. The B12 is the only B that comes from meat. So now all the women who've just had 3 kids, why are they hypothyroid, B12 deficient, iron deficient, and can't sleep? Because they just sucked up the vitamin D with their 3 babies. And those prenatal vitamins only have 400 international units in them, and they never get repleted. That's why they're overweight, cranky, can't sleep, have back pain, and are not laying by the pool in their bathing suit anymore. The second wife looks like that, not the one who bore your kids. Because she didn't get everything ruined by having the 3 kids, okay? One other thing, if you get leg cramps or more headaches, you need more magnesium, okay? This does sound a little flaky, but Dr. Fanous, I'm standing in the elevator, everyone greets me with the same greeting. I'm taking my vitamin D, and he says, I'm taking my vitamin D, but I have to tell you, if I don't take my pumpkin seeds, I get headaches. So if you get a little bit of headache or a little bit of leg cramp, you need a little extra magnesium. And since I don't really want to understand magnesium, because I feel like I'm already weird enough with this vitamin D, I just say, give him the sunflower seeds, that's easy. Okay, here are my basic concepts. One of the things that Dr. Perkins did for me, we blame our patients. I signed onto the internet about a month ago and said, what do they say about I can't fall asleep at night? All the teenagers that see me for headaches, they can't fall asleep at night. What do they say? You do it wrong. It's your fault. You stay up too late. Everything in medicine used to be, you'd go to the priest, 200 years ago, go to the priest. Father, I have blah, blah, blah. Oh, give me some money, go pray, you'll get better. It's your fault, you sinned, go pray. Now, you come into me, you say, I have blah, blah, blah. I say, okay, good. Give me some money, it's your fault. You don't exercise enough, you're too fat, your back hurts because you're fat, your feet hurt because you're fat, you don't eat right, and you don't sleep right. It's your fault. And I'll tell you, once I got into this D stuff, and my patients, you get them to the right D level, they just stop their sleep medicine. And it's working beautifully, except for the Parkinson's patient. It works beautifully. It's not your fault. It's medicine's fault. When I got into this, I thought, who is it that's telling the FDA not to give us enough? Is it the drug companies? And for a while, like 2 or 3 weeks, I was thinking, boy, there must be some conspiracy. And then I thought, you know what, those guys, they just want to make money. They aren't going to make pills for diseases that don't exist. These diseases exist because medicine screwed this up. You aren't going to make pills for reflux, depression, erectile dysfunction, sleep, high cholesterol, and the all, arrhythmia, on and on and on, unless the disease exists. That means it's my fault. This is my fault. I didn't see this. It didn't get into the literature that I was reading. I feel the same way as the other doctors. I don't care about vitamins. I don't care about nutrition one bit. I want to be able to do whatever I want to do, drink wine, eat a lot, and not be fat. That's what I'd like to do. So it turns out I think that medicine is responsible for this. It's a weird political mistake that still exists in the literature. There's a really good quote that Dr. Langston has in the afternoon that talks about how truth is always perceived as horrifyingly wrong by medicine to start with and then becomes accepted later on. I want you guys to have the opportunity. This is over the counter. Be careful with it. It's powerful and it will screw you up if you don't pay attention. Medicare will let you do this 4 times a year, as will all of your insurance. You need to know your level. You can make little assumptions about it, but every single person as they wake up in the morning needs something that they can identify that's not just, how's my sleep? Because if you're successful with this, your sleep will be great. You'll sleep for 8 hours. You'll wake up fine. Before it gets really terrible, you have to have something that comes back. For me, it was leg pain, back pain. For the next person, it's headache. For the next person, it's vertigo. For the next person, it's something else. You have to follow your level. You have to be really careful with this. And this has the potential to change the face of medicine, as far as I'm concerned, through the sleep. The sleep is still the most important part. If you stay up all night, even though your vitamin D level is fine, because you're partying, you're still going to feel crummy tomorrow. Okay? I tell my patients, you get your level back where it is, you have a kitten jumping on your head all night, like my husband and I have right now, it's not going to matter whether your D level's okay. It's the sleep that's the cure. What do? You measure the 25-OH, not the 125. If anybody you know is on D2, get them off of that stuff. Give them my handouts. I have a website. The website is not selling anything. The website is there because I run an hour late every day because I try to explain this to my patients. It is a lot to get your brain around. It's very complicated and it takes a lot of steps. From my point of view, it's not logical at all. And as soon as somebody comes in and I say, hey, maybe this is vitamins for your headaches, I don't want them to walk out of there and go, vitamin wacko. I want them to figure out why I'm thinking that it's their sleep that's going to make them better. Get your patients into 60 and 80 range. Keep them there. Whatever you feel comfortable giving or taking yourself, just start with that. Okay? Don't take 20,000. If you're well enough to be in this room, you probably don't need 20,000. Okay? If you're in the hospital, you might need 20,000 to give you a little kickstart so you can sleep to get better. And here's my grandbaby again. And thank you very much for listening.